Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the urinary bladder. The urinary bladder is a hollow muscular organ for the storage of urine for temporary basis. It is distensible and it is variable in shape, size, and position according to its content and the state of the neighboring viscera. An empty adult urinary bladder is located in the lesser pelvis. But if it is full, in case of retention of urine, it goes up. In case of children, it is an abdominal structure. It is separated from the pubic bone by the potential space of Regius. It is inferior to the peritoneum, resting between the pubic bone and the pelvic floor. So only the superior aspect of the urinary bladder is covered with peritoneum, and it is behind the pubic bones, partly above, partly inferior to the pubic bone, but it is behind the pubic bone and in between the pubic bone and the pelvic floor. If we go to the relationship of the urinary bladder, we find out that the apex is connected to the umbilicus by the median umbilical ligament, which is the remnant of the urachus, the embryonic urachus. Remnant is the median umbilical ligament. The base in female is related to the uterine cervix and vagina. The base in male is related to the rectovesical pouch. The vas deferens, we have two vas deferens and two seminal vesicles. Neck is pierced by the internal urethral orifice. Neck is the most fixed part of the urinary bladder. In male, the neck rests on the base of the prostate. In female, neck is related to the pelvic fascia. The superior surface is covered with peritoneum. The infralateral surfaces are devoid of peritoneum. Okay, so if you look at the images here, images of the, this is the hemisection of the pelvis, part of the abdomen here. This is the urinary bladder in a female here. Okay, it is related anteriorly to the pubic bone, posteriorly to the cervix of the uterus and the uterus, and it is related to the pelvic diaphragm and the urogenital diaphragm here. Okay, so we got that. So this is the relation, this is the apex of the bladder, and it is connected to the umbilicus by means of median umbilical ligament, which is the remnant of the embryonic urachus. This is the space, potential space between the urinary bladder and the pubic symphysis. We call it space of Regius. In case of male, again, this is the bladder, apex of the bladder. This is the median umbilical ligament going towards the umbilicus, and it is a remnant of the urachus. This is the retropubic space of Regius. This is the pubic bone. This is the urinary bladder, like female. This is the muscle. This muscle is the detrusor muscle. Inside we'll get the epithelium, that is the transitional epithelium. This is the prostatic part of the urethra here, internal urethral orifices here. Okay, if we just compare that with that of the female, again, this is the detrusor muscle, this is the apex, this is the base area, neck area is here, and lined by the transitional epithelium or urothelium. Okay. The ligament of the bladder, we have lateral true ligament containing fibrous tissue along with the cover of peritoneum. The lateral pivoprosthetic ligament, medial pivoprosthetic ligament in male, in female pivovesical ligament. They are fibrous tissue. The median umbilical ligament and posterior ligament of the bladder. We have some false ligament, those are the peritoneal fold only, the lacking of fibrous tissue. So these all are the true ligaments, the lateral true ligament, the lateral pivoprosthetic ligament, pivovesical ligament, median umbilical ligament, and posterior ligament of the bladder. Okay, this is inside the urinary bladder. What we look at that, this is called trigone area, bounded by the ureter on one side, another ureter. This is the interureteric fold here, and this part, the mucosa is very much shiny, and there is no folding of the mucosa here, and this is the internal urethral orifice. This triangular area is called the trigone. Okay, so this is trigone, and this is the interurethral fold. Again, this is the muscle, the detrusor muscle here. Lining epithelium is transitional epithelium or the urothelium. Okay, this is a coronal section of the male pelvis. We got the detrusor muscle, transitional epithelium, mucosa inside the bladder cavity. This is the internal urethral sphincter here. External urethral sphincter is here. This is the prostate gland. This is the prostatic part of the urethra. So again, prostatic part of urethra. This is the prostate. This is the neck region of the bladder. This is the neck, and this is the penile part of the urethra. We got that one of the ligament, one of the true ligament. This is the pivoprosthetic ligament here. In case of female, we'll get the pivovesical ligament. Okay, so this is the male urinary bladder because we are looking at the prostate gland. In female, there is no prostate gland. Okay, so this is the ureteric orifice here, internal urethral opening is here. This is detrusor muscle, and the superior surface is covered by peritoneum. Superior surface is covered by peritoneum. This is the apex of the bladder. It is the it is connected to the umbilicus through the median umbilical ligament. There is the remnant of the embryonic urachus. This is the posterior aspect of the bladder. In male, we are looking at the prostate gland. These are the seminal vesicle, and this is the vas deferens or ductus deferens. It crosses the ureter. This is one ureter. We should get another ureter that open on two sides of the trigone of the bladder, and another side we have the internal urethral meatus. Okay, that forms the trigone. We got the trigone here, one opening, ureter enters the bladder by an oblique fashion. This obliquity inside the wall of the bladder act as a sphincter for the ureter. This is the internal urethral meatus. This is female. There is no prostate gland here, and the urethra is very short in female. We have the external urethral sphincter. We should have internal urethral sphincter here, and this part, as usual, this is smooth part. This is lined by transitional epithelium. This part is also lined by transitional epithelium. This is the muscle. This muscle is the detrusor muscle. This is smooth muscle. This will contract and take the urine out. Sphincter will be open in micturition. Okay. So if we have gone through the interior of the bladder, what we got? The trigone. What is the boundary of trigon? Two ureter on both sides. Okay. Then one internal urethral opening. These 3 points forms the trigon of the bladder. Interureteric ridge is the connection between the line between the left ureter and right ureter. Uvula basica in male, that is in the trigon area, there is some protrusion of the prostate in male, that is called uvula basica. Okay, so if you go here, here we'll get this is a female urinary bladder. Okay, short or small urethra. Again, detrusor muscle here. This is a trigon, one ureter, another ureter, internal urethral opening. This is the internal urethral sphincter here. We have the external urethral sphincter here. Okay, we got that. And this is the female urinary bladder, female urethra here. Okay, capacity of the bladder, it varies according to the age and also depends on the physique. In adult male, on average, it is 220 ml. Filling beyond 220 ml causes desire to maturation. Bladder is usually emptied when filled about 250 to 300 ml. Filling up to 500 ml may be tolerated. Beyond that, it may be painful. It may be beyond that. Sometimes there is retention of urine. It may be even 1 liter. Okay. Referred pain is felt in the lower part of the anterior abdominal wall, perineum, and penis in male. When we go to the blood supply of the bladder, we have the superior vesical artery and also inferior vesical artery. In female, we have also the uterine artery, vaginal artery in lieu of inferior vesical artery. Okay, so we've also some innervation. We have also some blood supply from the obturator artery and also inferior gluteal artery. Okay, venous drainage will go to the vesical venous plexus. Ultimately, it will open into the internal iliac vein. Lymphatic will go to the external iliac lymph node, internal iliac lymph node, and also to the lumbar lymph nodes. Okay. Nerve supply is an internal organ, so it should have autonomic nerve supply, sympathetic, parasympathetic. Sympathetic is coming from T11, T12, and L1, maybe L2 segment of spinal cord from the lateral gray horn of the spinal cord. Okay, that is the sympathetic. Sympathetic carry the efferent fibers and are inhibitory to the detrusor muscle and motor to the internal urethral sphincter. Okay, so person can keep the urine. Due to that, parasympathetic, it should come from S2, S3, S4, motor to the detrusor muscle, so urinary bladder will be contracted and inhibited to the internal urethral sphincter. Sphincter will be relaxed, so person can micturate, can pass urine. Somatic innervation from the pudendal nerve through S2, S3, S4 that supplies the external urethral sphincter. So the two sphincter, external urethral sphincter is somatic innervation, internal urethral sphincter has autonomic innervation. Okay, so we got that. Now come the sensory fiber from the bladder. Pain sensation is carried by both sympathetic and parasympathetic nerve. Okay. Pain sensation is carried by the parasympathetic nerve mostly. Pain sensation from the superior aspect of the bladder is carried by the sympathetic nerve. Pain sensation passes through the lateral spinothalamic tract. That will go, it will, this is the ascending tract that go from the spinal cord to the thalamus. and thalamus is the center for all sensory function. Awareness of the distension is carried by the posterior column of the spinal cord. Okay, two things. One is pain, another is awareness. Pain through the lateral spinothalamic tract. Awareness of distension is carried by the posterior column of the spinal cord. Okay, we have some clinical anatomy. There may be rupture of urinary bladder, especially in full bladder. A person may have injury, may fall on sharp object. Someone may fall on the bicycle bar while riding upstairs or while riding the uphill or downhill. Okay, or some people may put two leg on two boat. They may fall. They may have injury. Retention of urine is a very common condition after the age of 55, 60, okay, due to benign hyperplasia of prostate. And the bladder can be palpated in the anterior abdominal wall because bladder has the capacity to be accommodated in the connective tissue in the abdominal wall in the fibrofitty connective tissue. So in case of retention of urine, we may palpate the bladder outline to the lower part of the anterior abdominal wall in an adult person. Cystoscopy is a procedure to look inside the bladder. It is done to visualize to find out any pathology inside the bladder. Suprapubic cystotomy is a surgery done in the urinary bladder. What is done? The urinary bladder is filled with normal saline or fluid so that the bladder should rise up. Then there will be suprapubic cystotomy is done. Autonomic reflex bladder that may happen in case of cervicothoracic spinal cord injury. There will be incontinence. Autonomous bladder that may happen if the sacral segment of spinal cord is injured. We call it autonomous bladder. Cystocele is not uncommon, especially in the elderly woman. There will be herniation of the urinary bladder to the anterior wall of the vagina. That is the cystocele. Herniation of the bladder through the anterior wall of the vagina. Okay. Now we have some Viva question. What is the function of urinary bladder? To store urine for temporary basis. What is the location of urinary bladder in an adult? It should be in the true pelvis, partly above the pubic body, partly below the pubic body, but it should be behind the body of the pubis. How the apex is connected to the umbilicus by means of the median umbilical ligament. What is the neck of the bladder? Lower part of the bladder, most dependent part of the bladder is the neck of the bladder. It contains the internal urethral sphincter and the internal urethral orifice. What is trigone? That is present inside the urinary bladder, a triangular area bounded by two ureter and the internal urethral meatus. What is uvula vesica? There is the protrusion of the bladder, the protrusion of the prostate into the trigone area. So in case of male, it is found that sometimes prostate gland is enlarged, it protrudes into the bladder, it pushes the trigone area. That is called uvula vesica. What is the blood supply of the bladder? Superior vesical artery, inferior vesical artery. We have also inferior gluteal artery, it may contribute. Also, we are getting contribution from other surrounding artery. In case of female, we'll get contribution from the uterine artery, from the vaginal artery. Now, the venous drainage through the vesical venous plexus, ultimately going to the internal iliac vein. Nerve supply, sympathetic from T11, T12, L1, maybe L2. Parasympathetic S2, S3, S4. Lymphatic drainage Mostly external iliac lymph node may go to the internal iliac lymph node, may go to the aortic lymph node. How pain sensation is carried from the bladder? It is mostly carried by the parasympathetic part, parasympathetic nerve S2, S3, S4. The upper part of the bladder, which is covered by the peritoneum, that area, the pain sensation is carried by the sympathetic nerve. That is T1, T11, not T1, T11, T12, L1, maybe L2. What is cystocele? That is the herniation of the bladder through the anterior wall of the vagina. Okay, so these are my references, and that's all about the anatomy of the urinary bladder. If you like my video, please support my channel. Please subscribe me, share the information with your friend, and any question, please feel free to ask me. Have a nice day. Bye now.